Tingling or numbness in the legs and feet is a sensation that most of us have experienced at some point in our lives. Sometimes it's temporary and harmless, like when your leg falls asleep from sitting too long in one position. But if tingling or numbness occurs frequently, lasts for a long time, or gets worse with time, it could be a sign of an underlying medical issue that needs attention. This strange feeling, often described as pins and needles, burning, or a lack of sensation, is your body's way of signaling that something in your nervous system, circulation, or musculoskeletal structure might not be functioning properly. In this video, we will explore everything you need to know about tingling and numbness in the legs and feet. We'll look at the most common causes, possible health conditions involved, home remedies, dietary support, natural treatments, and when to seek professional help. Whether you're experiencing this discomfort yourself or looking for answers for a loved one, this video will help guide you step by step. Let's begin by understanding the basics. Numbness and tingling, medically known as paresthesia, occur when there is an interruption in the nerve's ability to send signals to the brain and spinal cord. This disruption can happen for several reasons: pressure on a nerve, damage to the nerves, poor circulation, or certain diseases that affect nerve function. Often, these sensations are associated with conditions involving either the peripheral nervous system, which includes nerves outside the brain and spinal cord, or problems with blood flow, or even inflammation in the muscles or joints. One of the most common causes of tingling and numbness in the legs and feet is poor circulation. When blood doesn't flow properly to the lower limbs, the nerves may not receive enough oxygen and nutrients. This can cause sensations of coldness, weakness, or pins and needles. Poor circulation is often linked to conditions like diabetes, peripheral artery disease, PAD, obesity, or varicose veins. Sitting for long periods or standing in one position can also compress blood vessels, especially in the thighs and calves, contributing to numbness and tingling. Next, we need to talk about nerve compression and nerve damage. The most widely known condition here is sciatica, where the sciatic nerve, which runs from the lower back down to the legs, is compressed due to a herniated disc, spinal stenosis, or muscle inflammation. When this happens, people experience sharp pain, numbness, or tingling radiating from the lower back down one leg. Similarly, peripheral neuropathy is a broad term used to describe nerve damage in the extremities. It's often caused by diabetes, but also by B vitamin deficiencies, alcohol abuse, infections, and even certain medications like chemotherapy drugs. Diabetic neuropathy is especially common among long-term diabetic patients and often starts as tingling or burning in the feet before progressing to numbness or pain. Another cause is vitamin B12 deficiency, which plays a key role in nerve health and red blood cell formation. When you don't get enough B12, your nerves begin to malfunction, often leading to sensations of numbness or tingling, especially in the feet and hands. This can also come with fatigue, weakness, and difficulty walking. Vegetarians, elderly people, and those with digestive disorders like Crohn's or celiac disease are particularly at risk of B12 deficiency. Other vitamin deficiencies, such as B6, vitamin D, and vitamin E, can also contribute to nerve problems. Let's also look at musculoskeletal issues. Conditions like herniated discs, spinal stenosis, or piriformis syndrome can cause pressure on nerves in the lower spine or buttocks, which then affects the legs and feet. Sometimes tight muscles or joint inflammation in the hips or knees can also compress nerves locally, causing numbness. Wearing tight shoes, sitting with legs crossed for hours, or poor posture can aggravate these sensations. Autoimmune conditions such as multiple sclerosis, MS, lupus, and Guillain-Barré syndrome may also cause tingling and numbness as early symptoms. These conditions result in the immune system attacking nerves or the protective myelin sheath around them, interrupting signal transmission. These diseases are usually accompanied by other symptoms like fatigue, muscle weakness, balance problems, or vision changes. Another important cause is alcohol-induced neuropathy, which occurs in people who consume alcohol excessively over time. Alcohol can be toxic to nerve tissue and also depletes the body of essential nutrients, particularly B vitamins, worsening the condition. Some people also develop chemotherapy-induced neuropathy, where the cancer treatment damages nerve endings, leading to persistent tingling or numbness in the feet and hands. Certain infections, like Lyme disease, shingles, and HIV, can also affect the nerves. For example, shingles can cause nerve inflammation that leads to intense burning or tingling sensations, even after the rash disappears. Additionally, people recovering from COVID-19 have reported persistent numbness or tingling in the limbs, which may be related to nerve inflammation or autoimmune reactions triggered by the virus. Medication side effects can also play a role. Some blood pressure medications, statins, chemotherapy drugs, and anti-seizure medications may have neuropathy as a side effect. It's important to review all medications with your doctor if you experience persistent numbness or tingling. Now let's talk about natural treatments and home remedies. The first step is improving circulation and reducing inflammation. Walking regularly, even just 20-30 minutes a day, improves blood flow and oxygen delivery to the legs and feet. Stretching exercises, especially for the lower back and hamstrings, can help reduce nerve compression. Gentle yoga poses like downward dog, child's pose, and spinal twists may also help relax muscles and free compressed nerves. For people with sciatica or herniated discs, applying hot or cold packs to the lower back may provide relief. Cold packs reduce inflammation, while heat helps loosen tight muscles. Alternating between the two can be especially effective. Similarly, foot soaks in warm water with Epsom salt can relax foot muscles and improve blood flow. Diet is crucial. Make sure to include foods rich in vitamin B12, such as eggs, dairy, fish, poultry, and fortified cereals. If you're vegetarian or vegan, you may need a B12 supplement. Also focus on foods high in vitamin B6, such as bananas, chickpeas, salmon, and potatoes, as well as vitamin D from sunlight or foods like mushrooms, fatty fish, and fortified milk. Magnesium-rich foods, such as leafy greens, almonds, pumpkin seeds, and avocados, are essential for nerve and muscle function. For anti-inflammatory support, add turmeric, ginger, green tea, and omega-3 fatty acids from flax seeds, walnuts, or fish oil to your diet. These reduce inflammation and support overall nerve health. Stay hydrated. Dehydration can worsen nerve symptoms. Another helpful remedy is massage therapy. Regular foot or leg massages using warm oils like coconut oil, mustard oil, or sesame oil can stimulate nerves, improve blood circulation, and relax tight muscles. Adding a few drops of lavender or peppermint essential oil can provide additional pain relief and calming effects. Acupuncture, an ancient Chinese therapy, has also shown promising results in treating chronic nerve pain and tingling. It works by stimulating specific points in the body that help restore energy flow and nerve function. In terms of supplements, methylcobalamin is a bioavailable form of vitamin B12 that is especially effective for nerve repair. Alpha-lipoic acid is another powerful antioxidant used to treat diabetic neuropathy. CoQ10, magnesium, and vitamin E also support nerve health. However, always consult a healthcare provider before starting any supplement regimen. For people with diabetic neuropathy, keeping blood sugar under control is the #1 priority. High glucose levels damage nerves over time, so managing diabetes through a proper diet, medication, and lifestyle is essential. Similarly, reducing alcohol intake, quitting smoking, and managing blood pressure and cholesterol also play a big role in protecting nerves. When should you see a doctor? If the numbness or tingling is persistent, progressive, or accompanied by muscle weakness, balance issues, or difficulty walking, it's important to get a full evaluation. Early diagnosis can help prevent permanent nerve damage. Your doctor may order blood tests, nerve conduction studies, MRI scans, or EMG tests to determine the exact cause and guide treatment. In conclusion, tingling or numbness in the legs and feet is more than just an annoying sensation. It can be a warning sign from your body. Whether it's poor circulation, nerve damage, vitamin deficiency, or something more serious, paying attention to this symptom is important. With the right combination of diet, lifestyle changes, exercise, and natural remedies, you can often manage and even reverse the underlying causes. Remember, the body speaks in signals. Listen to it, take early action, and seek medical help when needed. Your legs carry you through life. Treat them with care and they'll support you every step of the way.